Being in hospital has got risks and benefits. For patients with imminently life-threatening illness, it is of immense benefit. Prolonged stays do, however, carry the risk of deconditioning, hospital-acquired infection and post-hospital syndrome with loss of confidence and stress. The IAWN tool is a brief check to see whether someone might be better off at home. IAWN can be done by anybody involved in the care, starting on the day of admission. A positive answer, green, to each of the 4 items IAWN means a good chance that the patient is ready to go home. A negative answer, red, means that specific actions are needed. I, for improving, is the patient's main condition improving? If they have been admitted with acute kidney injury, is their creatinine getting better? If they have been admitted with infection, is their temperature coming down? If they have been admitted with pain, is their pain score improving? If they have been admitted with sepsis, is their NEWS score and CRP getting lower? Most patients with a NEWS of less than 3 can be looked after in their own home. If a patient is not improving, question the diagnosis and review the treatment. Consider escalation to a senior colleague. A. For ask what worries your patient. Have you discussed with the patient what worried them? Have you been able to answer their questions or signpost them to someone who can? In a recent study, 50% of patients voiced that their clinician did not know what mattered most to them during an acute hospital admission. We can't fix everything, but we can at least ask. W. For walking is safe for own environment. For some patients, that might be to get from their bed to the toilet or commode. Some patients are bedbound. Some patients might have to do stairs. In a frail, elderly population, mobility is the key strategic issue for discharge. Keep patients moving every day. This is everybody's job, not just for the physiotherapist. N. For negotiate with usual carers. This item applies to frail patients and those with learning disabilities. The usual carer can be children, parents, friends, or professional carers. Usual carers will know what is normal for a patient and what they need to be safe at home. Always interview the eyewitness, ideally at the time of admission, or at the latest within 24 hours of admission. This spares you and your patients unpleasant surprises. Negotiation has to support realistic expectations to allow stretched resources to be allocated to those who need them most and where needs cannot be met by family and friends.